Welcome back to the Back Pain Solutions podcast with me, Ben James, doing another solo show this week, talking about hip mobility and the hip back, hip spine connection, if you like. This is a topic that we've discussed before, but I had a listener reach out, and they're in their mid-40s, and they've noticed that over the last 18 months, they've found quite a bit of discomfort in their hips when they're doing deadlifts and squats. So I want to dive into that because this is actually something that I've experienced a little bit myself and have adapted the way that I stand. So there's anatomical kind of scenarios, questions we need to consider here. There's the general understanding of why the hips are important with respect to the spine and spinal health. And then there's questions as to, well, what can we do to look after our hip mobility in the best way? Okay, so let's start with the kind of the connection between the hip or the hips and the spine. What we know, what evidence tells us, is that largely we want to focus on good hip mobility and back stability. This shouldn't be anything new if you've listened to our podcasts before, but it is important, as always, to reiterate. A lot of patients that we see will say, oh yeah, I've done a lot of stretching for my back, I'm doing a lot of stretching to help my back. But for the most part, we would take a step back and say, well, okay, perhaps in certain instances, some stretching in the low back may be beneficial. But for the most part, we want to take a step away from that approach. But we want good hip mobility. Because if our hips are not mobile, then we start to require the back more. So for example, if you are someone that goes to the gym and you're lifting weights and doing squatting exercises and you're trying to squat deep, as a lot of patients try and do, if you don't have the mobility in your hips for one part, then as you get lower down, as your bum sinks lower to the floor, then you can get this butt wink where your bum tucks under and in and you flex a little bit through the lower back. And that is a big risk factor for lower back issues. And we see this a lot in clinic. So focusing on hip mobility might help in those scenarios. Now, there are anatomical questions that we need to consider, but let's just, for now, just focus on that hip mobility and lower back stability. So we want maximum mobility within limits within the hip, because we don't want to push it and lead to instability and labral tears and irritation of hip joints. But we know that kind of connection matters. So we know as a rule, hip mobility, lower back stability. And if we've got stiff hips, and we see this a lot, then that needs to be addressed, because otherwise we're constantly compromising the back through activities of daily living. So if I'm trying to bend down and get something off the floor, or if I'm just simply trying to load the washing machine with clothes and I'm trying to bend through my hips to do that and they're stiff, then I'm inevitably going to bend through the lower back. So we need to focus and be mindful of that as part of any rehabilitation plan. Okay, so that should be the kind of general rule. Now there's dangers to overstretching. We don't want to really push it and try and force that movement, because some people anatomically just will have a hip joint that just doesn't allow flexion. So that's the kind of thigh coming up, if you like. It doesn't allow flexion past 90 degrees, and that might just be genetically, anatomically, they're the limits. And this is why we sometimes get frustrated with the kind of CrossFit approach, whereby there seems to be this demand to squat below the 90-degree mark. So we've got to be a little bit cautious with that. Now, it might be that you can get past the 90-degree mark with a wider stance versus a narrow stance. And this is something that I've had the listener that reached out go away and explore, because it's definitely something I've noticed in myself. I didn't used to have so much issues with a narrow stance. I've got pretty good mobility through the hips and good flexion through the hips past the 90-degree mark. But actually, when I've been doing more deadlifting over the past 18 months, with more of a narrow stance, so my legs, my feet not so wide apart, and a grip with my hands on the outside of my legs, so a little bit wider along the bar, I really noticed a little bit of pinching in the groin area and in the hip area. It was quite uncomfortable. And so I've adapted that to have more of a sumo stance. So my legs are wider apart and my hands come inside my legs to grip the bar. And I find that very, very comfortable. And I also find that from a personal point of view, I just feel like a better activation through the glutes as well in doing that. And it really does allow me to keep that back nice and neutral, no kind of butt wink as I'm going down. I keep my back nice and straight, which is really, really important. And I also find it helps me just really engage the lats a little bit more for me. But it was very much driven by this discomfort in the hip. So we want hip mobility, but we don't want to push it and challenge it and irritate the tissues, because within the hip joint there's the socket, of course, which is on the pelvic side, and then you've got the ball of the hip joint of the thigh bone, the femur, that slots into that. It's a very deep and stable joint, but it is deepened by the labrum, which is a cartilaginous tissue. So if you're forcing movement through the hip and trying to challenge your innate anatomy, let's say, then we could irritate that tissue, and we could over time create tearing in that tissue. And we see this in practice, and no doubt there are a lot of people with degenerative tears that aren't suffering from any issues, but we don't want to irritate and sensitize those kind of delicate structures where possible. So we've got to be a little bit cautious. We've definitely got to be mindful of anatomy. So don't push it, but we need to kind of move into it and explore it to maximize mobility through the hips within anatomical limits, if you like. And one of the ways that we like to do that is looking at it more as a active stretching versus static stretching, because often people really force static stretches, and doing more of an active stretch, which we'll talk about a little bit towards the end of the episode, can be more beneficial in terms of preventing that forced kind of stretch or movement through the joint. So explore that if you're listening and you find that squatting down, for example, whether that's at the gym or whether that's at home just doing simple activities of daily living, if you're finding that as you're trying to sit down onto a chair or squat down to lift something off the floor, whatever that might be, if you're finding that you're getting a bit of discomfort in the hips and you feel as a result that you're bending through the back to aid that movement, we definitely need to optimize that and explore that to prevent the movement through the back, because we don't want to compromise the back as a result of kind of discomfort through the hips. So explore the stance a little bit and maybe widen that stance, turn the feet out a little bit. That might just help to ensure that you don't get this discomfort through the hips and you're able to keep that back nice and neutral and straight as you're lowering down through that movement. So explore that the stance particularly if you are finding that a bit of an issue. That's definitely something that is relevant to everybody. So we've got to be aware of hip anatomy, and we've got to be aware of varying the stance to allow good hip mobility without compromising the back or the hips at the same time. So hip anatomy, does vary. Some people just naturally better suited to a narrower stance and some to a wider stance. And if you're unsure, if you're not finding that you can comfortably establish that, then just reach out. We can always jump on a call, have a quick Zoom and discuss and demonstrate that. So we always ask patients or listeners, just get in touch. www.smartstrong.co.uk. Get in touch with any of your specific questions. We can always jump on a exploratory call to look at that if it helps. But definitely something to consider. And it's about finding your optimum, if you like. Okay, so be sure that you're managing to find that mobility in the right way to prevent compromise of the low back is the take-home message to that. But at the same time, don't be forcing hip mobility. We want to strengthen the glutes. We know we want to strengthen the abdominal kind of core, as we've discussed before, and we want to open up the hip flexors as a rule to aid this kind of good hip movement and good spine stability. Okay, and so some of the things that we want to take away in terms of exercises to really drive hip mobility. So there are some kind of static stretches we might recommend as a starting point of flexibility. But as I mentioned, largely we want to look at a little bit more dynamic stretching so that we're exploring the different ranges of the hip without compromising the hips and certainly not compromising the low back. So one of the exercises that we really love to do as part of a rehab program, and that depends on the stage that you're at, is the hip aeroplane. So the hip aeroplane is a great example whereby, let's imagine you're standing on one leg. Okay, you might take a little bit of support on the wall initially to do this with one hand. So let's say I'm standing on my right leg and I've got my left leg kind of counter levered back behind me. So I keep my leg straight and I extend it at the hip so it's behind me. Little bit of a flex through the knee, a little bend through the knee on the right leg, and then I'm doing a bit of a hip hinge over that right leg. Okay, put my right hand on the wall for a little bit of stability, and then what we're doing there is keeping the back in neutral. So we're not bending through the back, we're not bending side through the back remains straight, remains stiff, and then we're essentially pivoting, rotating on that standing leg. So you're standing on your right foot, slight bend through the right knee, flexing forward through the right hip, so the hip hinge, and then set that movement and rotating round through that hip. And you can explore that range and dip forward and rotate backwards, really exploring that range of motion through the hip. But we're keeping the core neutral and stiff at all times. So imagine that your kind of your lower back, your mid back is stiff. So you essentially your shoulders and your hips are moving together and just pivoting over that right standing leg, and then of course do it on the other side, on the left side. But it helps to really open up the hip. It will stretch the hip flexors, and it'll also activate the glutes. So it's a really nice way of stretching through the hip flexors, which we want, activating the glutes, which we want, and opening up the hip whilst keeping the back in neutral. So it's a great exercise to really explore that range of motion and activate the relevant muscles that we're looking to activate. And it will also help improve your stability. So we know that long term, as we age, we want to really be mindful of stability and preventing falls. So there's multiple benefits to doing this exercise. So it's a really, really great exercise to do. The other exercise that is really good is the 99 hip switches. This is a little bit difficult to explain on the podcast, but if you just type it in online, 1990 hip switches, you're essentially sitting down with your knees in 90 degrees. So let's say I'm sat down, my right leg on the outer part of my thigh is on the floor with my knee at 90 degrees, and my left leg is at 90 degrees with the inner leg on the floor. Okay, and then what you're essentially doing is switching that movement. So the left leg comes up, keep the right leg in contact with the floor, left leg comes up, and you're working way through movement and mobility through the left hip, keeping the back in neutral, so we're sitting with a nice neutral spine. And this is something you unlikely would do if you're suffering from acute pain at the moment, because we want to avoid those kind of seated challenging positions. So this is again, as always, it's about finding the right exercise at the right time But in terms of general mobility through the hips, if you're not suffering, this is a good exercise. So you're lifting that left leg off, and at a certain point, you'll reach a point where the right leg starts to come off the floor, the left leg goes down to the floor, and you rotate your body as one, and then the inner part of your right leg touches the floor. But have a look online. Great way of, again, just activating that hip mobility and getting good range of motion through the hips. Another one is the goblet squat. So what we're doing there is we're taking a kettlebell, keeping back in neutral, we're holding that weight into the body, and we're squatting down. Legs are generally, or feet are generally quite wide apart by doing this, keeping the back in neutral and lowering the bum down towards the floor, but challenging it under load. A great way again of just getting a good stretch through the hips, but in a very fundamental dynamic movement, which is the squat, which we're doing as part of a lot of activities on a daily basis. So learning to squat well is a really helpful thing to do. But the goblet squat challenges it under load, challenges range of motion through the hips. Another great way of also activating the glutes at the same time. So that is also another great stretch, but it's more of a dynamic movement. So we're not just statically stretching the hip and holding, we're dynamically moving the hip in that motion. But again, it will help to activate the relevant muscles whilst challenging that mobility, or maximizing that mobility in a functional way. And then the last one that is worth considering, and again, depends on your journey of recovery as always. I'm talking at the moment just general hip mobility for those that likely aren't suffering from discomfort, because for those suffering from discomfort, we need to get that plan correct, and that always has to be an individual program if you're really suffering. But the Cossack squat. So essentially, this is where you're standing in a kind of squat position, let's say, or you're standing upright, legs feet apart, and then you're squatting but laterally. So let's say I'm standing upright, my legs are about shoulder width apart, a little bit wider maybe, and then I'm squatting to the right side, so my right knee is drifting over my right foot, and I'm squatting right down but laterally, and then I'm doing it to the left side. So that's a squat to really challenge the kind of lateral movement through the hips, and again, as always, keeping back in a nice neutral position. So there's 4 exercises there that really allow you to explore hip mobility and start to introduce into your daily routine, whether that's before you train, whether that's a day when you don't train, but regularity is the key with respect to building good flexibility, good mobility. But those exercises really allow you to start building good hip mobility whilst being mindful of maintaining neutral spine, keeping the core stable, and activating the muscles that we want through the glutes and stretching the muscles that we want through the hip flexors. So 4 exercises to really consider, but don't underestimate the importance of good hip mobility for lower back health. Be mindful of hip anatomy, and not everybody is built the same. So some individuals will benefit from more of a narrow stance versus a wider stance, and that's something that needs to be explored a little bit with the help of either a personal trainer or by reaching out to us. And then trying to introduce dynamic stretches, movements that allow us to build good hip mobility without compromising that hip anatomy, but at the same time maintaining the neutral spine and looking after our lower back. So I hope that's been helpful, and no doubt I'll get some feedback from the listener that reached out soon with respect to their particular stance that will be of benefit, because as I mentioned, it's definitely something I've started to experience a little bit, that I've been getting a little bit of discomfort in the hip area, in the groin area with a narrow stance, and introducing a wider stance has changed the game for me with that regard. And I think the key there is that constantly exploring and adapting versus I must not do that exercise anymore because I get a bit of discomfort through the hips. No, let's just vary the stance and keep doing the exercise, because we want to keep people doing the activities that they love. But as always, thank you for listening, and I ask again, if you've got any questions, reach out, get in touch. www.smartstrong.co.uk is the website. Download the ebook there. We've had some great feedback on that. It's a really useful guide if you're on this journey of recovery. And if you've got any questions, info@smartstrong.co.uk, send us an email. We'll happily send a response or jump on an introductory call and do the best that we can to help you guys get back to the activities you love. Thanks again for listening. And as always, we'll be back again with another episode soon.